Hi, you are welcome once again to another interactive, educative, and entertaining segment of the Sonia's Fallow Show. Today, we want to talk about antenatal care. Yes, so I guess you understand about the fact that we are here for our expectant mothers, our expectant sisters, aunties, grannies, what have you. We are here for our women who are pregnant. And to help me with today's discussion, I have here with me a certified public health nurse who is in the person of Immaculate. I'm sure you have seen her once before on this show, and she's here again to help us understand what this whole antenatal care is all about. Immaculate, you are welcome.
Thank you.
Well, let's just jump right into it. When we talk about antenatal care, what is it, please?
Okay, so antenatal care is the specialized care given to any pregnant woman.
Specialized care
Yes,
given to any pregnant woman.
Yes.
Okay. We will come back to the fact that it is specialized.
No,
But
okay.
why do pregnant women need antenatal care in the first place?
Okay, so we need the pregnant women to come to the facility for care.
Okay.
With the reason that we have to be problem oriented.
Okay.
And then we also have to run some tests to detect if they have any conditions that may affect the health of the baby.
Okay.
We also have to give them education on how to live their lives as a pregnant woman.
Okay, so that is basically why there is the need for antenatal care when you are pregnant.
Yes.
All right, so at what point of the pregnancy should the woman or the lady start coming for this special care?
Immediately the woman thinks she is pregnant, she should come to the facility. But the care actually starts between 8 to 10 weeks of pregnancy.
Okay.
But ideally 10 weeks.
10 weeks of pregnancy.
So
the 10 weeks of pregnancy, that should be 2 to 3 months into the pregnancy.
Yes.
Oh, okay. All right. So now, talk to us. In defining what antenatal care is, you mentioned it is a specialized care given to pregnant women.
Yes.
To know whether there is any preconditions, whether the baby is fine, anything, just to make sure the pregnancy is safe and the baby is safe. What really goes on during antenatal care?
Okay, thank you. So when the pregnant woman or a woman who thinks she is pregnant comes to the facility, she will first be registered into this book with this book.
Okay,
this book will be given to the mother.
Okay.
Or the expecting mother.
Okay.
And then also we do physical examination on the pregnant woman, head to toe physical examination.
Okay, so when you say physical examination, what really goes into that physical examination?
So we are going to look at the whole external body of the pregnant woman. Yes.
Okay.
So we are looking at from the hair to the scalp, to the face, to the neck, the upper limbs, that's the arms, the abdomen, the breast. We are looking for alignment. The upper limbs and the lower limbs, the legs, the legs and the thighs. And we are looking at the abdomen, the straightness of the spine. If there's any deformity, the back. Yes. And we are going to look for any maybe abscess in the breast and in the abdomen. If there is any precondition that we have to look for, that's the physical examination head to toe. We are looking at everything about the pregnant woman. Yes.
All right. So after the physical examination, what's next?
Yes. So the woman will have to run some scans during the 10th week of pregnancy. The woman has to go for a scan to know the gestation of the developing fetus. They want to know how old the
The
baby
baby
is
is in the
or
womb.
the fetus is.
Okay, so
So
is that the gestation
yes,
or it means
how
something
old
else?
the fetus is the gestational age.
Okay.
Yes.
Alright. Okay.
So that's what we are looking for.
Okay.
Yeah.
So please
So we
continue.
do lab investigations too.
Okay.
Yes. So we are looking for any condition, disease condition. We are looking for. We want to check the hemoglobin level of the woman, the pregnant woman. If it
Okay.
is less than 11 grams per deciliter, then it means the woman is anemic.
Okay.
Yes, but if it's not less than, then she's okay.
Okay.
She's fine. She just has to continue the medication given to her, which is iron tablets and fesolate.
Okay.
Yes.
So that means during antenatal, there are medications given to the pregnant woman to take.
Yes.
So if I may ask, is the medication solely for the mother, or it's to some extent also protects the health of the baby in the womb?
Okay, thank you. So for the first 3 months of the pregnancy, it's very vital.
Okay.
It's very, very delicate. So this is when the woman needs more of the blood,
Okay.
because that's what how will I say? That's when the developing of the fetus.
Okay.
That's what the fetus would depend on. The fetus
okay.
is depending solely on the mother. So if the mother doesn't have enough blood, she will become anemic.
Okay.
Yes.
So assuming assuming the mother is anemic, does it affect the development of the child?
Yes. The first 3 months, mostly the fetus head develop, the nervous system, the head and the spine, the brain and the spine
Of the child?
Yes, of the
develops.
child. It
Okay.
develops first.
Okay.
So if there's no enough blood in the development, it's going to cause what we call spinal bifida, or the spine is not going to close completely. There's going to be a hole or a deformity.
Okay.
And the brain too will have brain anencephaly. So the brain will not develop well. That's why sometimes, excuse me to say, when they deliver a baby without any proper antenatal care, you realize that some of the babies, they have deformed head. They are not able to walk properly. Their limbs are not well developed.
Okay.
Yes, so they rely solely on the mother for development.
So if I understand what you just said, it means the first 3 months.
Yes.
Is that also called the first trimester?
Yes, first trimester.
The first trimester is very, very critical for the development of the baby.
Yes.
So if the expectant mother does not do certain things right, it can change the life of the baby.
Yes, the life of the baby. Or let's say the normality of the baby is going to change.
Okay. So those are some of the reasons we have, excuse me to say, some of these deformed babies.
Yes, sometimes too, it's already in the family. It's genetic. So for that one, I think extra specialized care will be needed, or maybe there's nothing that can be done about it because it's already in the gene of the family.
Alright.
Yes.
Okay. So you mentioned physical examination of the woman.
Yes.
That's from the head to the toe, and then they do some scans.
Yes.
To check the gestation of the baby. After the scan, they do some labs.
Yes.
And the labs, basically, they check the blood level of the mother.
And they do other labs like urinalysis. They want to know if you have maybe more protein in your system,
okay.
your urine,
Okay.
or more keloids, more protein, in a sense that maybe you could be having a kidney failure or something. They just want to know, yes, the mother. They just want to know if everything is right with the mother for the next couple of months ahead of her.
That she be
Yes,
having that baby in her womb.
yes.
So basically, antenatal care is entirely, if I understand you right, it is entirely about the health nature to check the health of the mother in order for it not to affect the baby being formed in any way. All right, Immaculate.
Yeah.
So you mentioned physical examination, scans, and labs.
Yeah.
What else goes into antenatal care?
Okay, so we'll take the history of the mother.
Okay.
First, we are going to take the mother's personal history. That's the first thing we are even supposed to do.
Okay.
In the book I showed earlier.
Okay.
The maternal book. So we are going to take the personal history of the mother.
Okay.
And name, age, occupation, and religion and stuff
Every
like that.
necessary
Every necessary
information
about herself.
Okay.
And then the social history we are going to talk about. We're going to ask of her occupation, like what work she's doing,
Okay.
and which church she attends, her husband's work, and and then we are going to ask of the medical surgical history. If she has ever, if she has this, if she currently has hypertension or diabetes, if she has any heart condition, if she has asthma, she's allergic to any drugs, or yes, something like that.
Any
and
underlying
condition,
condition
any underlying
that
condition
may affect the
exactly.
child.
And then we are going to the surgical side. We ask if she has ever had an accident before, if they've ever done an operation for her, myomectomy or something. Yes. And then we are going to ask about her past obstetric history.
Please
I'll
clarify that.
Her obstetric history is if she has, maybe if she has ever been pregnant before. If she has children. The number of children she has. And then the timing in between the children. The sexes of the children.
Wow.
So assuming she has 5 children within a space of 11 years,
she should have those 5 children.
No, I'm just saying, assuming she has 5 children within the space of 10 to 11 years, and she's currently pregnant in her 12th year, which means the last born is not even up to 2 years or even a year old, then we'll have to educate her extensively on the dangers of carrying multiple pregnancies within that short space. Yes.
So it's not safe.
It's not safe to have multiple births within a short period of time. It's not safe for you, the mother. Your body needs to relax and prepare well for the next pregnancy.
And adjust back to your body itself.
Yes.
So, talking about safety over here.
Yes.
What should be, is there any specified range?
Yeah.
Let's say between the first pregnancy and then the second pregnancy. I mean, age.
Yes.
Yes. Is there anything like that?
You mean age or the duration after each pregnancy?
Yes, after each pregnancy.
Yes. So ideally, it should be at least 2 years after the first pregnancy.
Before you take
after the first delivery. Yes.
Before you take
after.
in again.
Yes.
By
that is believed that within the space of 2 years, your body has healed and is relaxed, and it has prepared itself enough
for another
pregnancy.
Wow.
But then, if you, the mother, want to follow that trend, it shouldn't be multiple pregnancy at like within 2 years. 2 years. If you think you can go through that, and your doctor says it's okay for you to have, maybe personally you want to have 7 children, and currently your first pregnancy, you had your first child at 23 or 24, and
Okay.
you want to finish giving birth by 35,
Mm-hmm.
your doctor should be able to, take you through some tests or maybe give you education or on how it might affect you, the mother,
Okay.
and the
So
baby as well.
basically, an
Yes.
examination should be done
Yes.
on your body
Yes.
to see if
Yes.
it can be able to go through that
Yes.
stress. Should I call it stress?
Yes, it's a stress in quotes.
Okay.
Because once a woman is pregnant, she's
Okay.
assumed to not be normal.
Okay.
She's not a normal human being again. She's a different person in her own world.
Okay.
Yes.
Alright. So what else? Do you have any other thing to add to what goes into antenatal care?
Oh, okay. So we'll talk about we'll give you health education as well.
Okay.
Yes, health education. So we are going to talk about you see, this book contains a lot.
Okay.
But some pregnant mothers, should I say, are ignorant of the fact that they have to learn from this book. It's not, they don't have to wait for the next antenatal visit for their nurses to tell them everything that is in this book.
Okay.
That is why it is advisable that if you can read,
Okay.
then you should read. If you cannot read, look at the pictures in the book.
Okay.
Yes. So, for example, prevention of malaria. You can see a pregnant woman sleeping in a treated mosquito net.
Okay.
So the woman will be given a treated mosquito net as well.
Okay.
At the antenatal clinic.
Okay.
Yes. So it's advisable, and then taking your iron and folic acid tablets as well. Going to the hospital, your regular antenatal visit. But it's advisable that if you, the mother, is not feeling too well before your next visit, you should still go before the next visit. So these are all health educations in the book. We are going to talk about the personal hygiene of the woman too as well. Rest and sleep, exercise. Rest and exercise. There are simple exercises that the woman should do by her third trimester. That is when she's about to deliver.
So you'll be taught all this
during the antenatal care. But it's good if you, the pregnant woman, also learns from this book. Now you can also have safe sex. We talk about safe sex. Yes, and there are some positions that the pregnant woman should engage in. We are going to show the pregnant woman all those things. There are some people who say they are tired. Some pregnant, they feel tired. But it's advisable to, have the safe sex. We have a way of teaching them.
But what does it do to the baby?
Okay, so it doesn't do anything to the baby. It's rather going to, the sperm that is going to help the cervix. It's going to soften the cervix of the woman so that when she's dilating, it will be faster.
Oh, okay.
Yes.
So basically, that's the reason behind the safe sex during pregnancy.
Yes. Oh. But basically, at the second to third trimester.
Oh, okay.
Yeah.
All right. That's
the
standard.
Then we are going to talk about the nutrition aspect. So it's very important.
Okay.
It's very important for a pregnant woman to eat at least 3 times a day, and in between meals should take snacks and fruits.
Okay.
If she can eat more than 3 times it is okay.
But some people eat a lot.
Yes.
They say they are eating for 2 or even 3, depending on the number of babies.
Sometimes it's their craving.
Weird ones.
Yes. So some of them, they crave a lot of sugar. That is why we have something we call diabetes in pregnancy.
Oh.
Yes. So
that's why you are craving for sugar.
Some of them don't want to eat. They don't feel like eating, but they feel, when I take, excuse me to say, malt.
Okay.
So at the end of, by the time the day closed, they would have taken about 5 bottles of Guinness,
and they will be fine.
That's
meanwhile, what they want to say.
Yes. Meanwhile, they end up having diabetes.
Yeah.
In pregnancy.
Wow.
Yes. Some
So-
of them to create something we call pica. Pica is ice, clay, a hair or kaolin.
Ooh.
Yes. Some create charcoal. They are all not
Yeah, we have
good
weird
for
cravings.
the
So
pregnant man and the baby as well.
when it happens that way, what would you advise?
Okay, so when it happens that way, we advise the pregnant woman to seek help from the health professional.
Okay.
Yes,
But
so we advise them to try and eat more of green leafy vegetables or any
Okay.
food that they feel they can eat, but in bits.
okay.
In
Okay.
bits, not
Okay.
pica.
Because the
Yes.
symptoms sometimes
There's no iron in them, there's no nutritional value in them. We need more iron in the system for the development of the fetus.
Okay.
Yes.
Alright. So in this case, would you advise that with the issue of the cravings, it's good pregnant women attend antenatal with their husbands?
Yes.
Or someone they live with in the house?
Yes.
So that the person can be sort of a check on them.
Yes, it's very good. We are trying to involve something we call male involvement. We've introduced male involvement.
Okay.
So in a sense that when you come to the antenatal care with your husband or a male figure, they try to attend to you first, so that next time you'll be encouraged to come.
Oh,
yes.
So special treatment for the
The
ladies
men,
who come with their husbands or a male figure.
Yes.
Oh, okay.
But specifically, it should be the husband.
The husband.
Yes.
Oh, all right. Okay. Is any other thing to add?
Yes, I just want our pregnant women to take their nutrition seriously and their health, their personal hygiene seriously. Yes, because you can't, as a woman, you can't wake up in the morning and depend on staples only. Like you drink cocoa with bread.
Yeah.
Big bowl of cocoa with bread in the morning, and in the afternoon you don't take between morning and afternoon you don't take any fruit or snack, maybe biscuits or roasted meat. But the next thing you eat is let's say kinky with small fish. Yes, meanwhile you can take rice or maybe cocoa, bread and groundnuts.
Okay.
Yes, you're going to get
So
fat
it's
oil too from the groundnuts.
Okay.
And we can in the afternoon you can take, let's say, beans or beans and rice with a little fish or egg protein. So you're going to balance your diet.
Yeah,
In
basically.
fruits too, you can take the fruits that you are comfortable with. Some people already have ulcer, so it's not necessarily for them to take pineapple and orange and those citric fruits. You can take mango when it's the season, or something else that they are comfortable with, and drink a lot of water. Yes.
Okay. Thank you very much.
You're welcome.
Is it 100% safe to sit at home and depend solely on the traditional method as a pregnant woman?
Yeah, it's a yes and no answer, because we have people we call traditional birth attendants.
Are they trained?
They are trained. Yes, they are trained. Yes, so they are inside the community. So those kind of people, they give herbal medicines. So they are trained in the sense that they have to know the quantity of each of the drugs they give to the pregnant woman. But as for you, the pregnant woman, it depends on you. Maybe you tried it before and it worked for you. Maybe you've never tried it before and you want to do it. Or maybe your mother or your somebody in the family has done it and nothing happened. So you want to depend solely on that one. But however, it is good when you come once in a while to the facility for scans and labs and the rest, to monitor, not just monitor alone, but to check for any underlying conditions that may affect you and the mother and the baby as well.
So then no, I take it that if you don't have a trained traditional birth attendant in your
Don't
community,
attend it.
you have to
Yes.
always go for antenatal.
Yes.
But if you have such a person, such a person can attend to you.
Yes.
Then once in a while, you visit the facility.
Yes.
too.
Yes.
All right. Okay. Time is against us, so let's have your final words for our pregnant women out there. What do you have to tell them?
Okay, so I'll encourage my pregnant women, my dearest pregnant women, to please visit the antenatal clinic regularly on time. And if you do not feel well at any particular point of time, you should still go. Take your nutrition seriously, take your personal health seriously, and make sure to prepare well for delivery. Thank you.
Well, thank you very much, Nurse Immaculate. Well, I hope you've been educated to some extent. We can't talk about everything over here due to time factor, but I believe you've learned a lot. And as a pregnant woman or an expectant mother, we just heard that it is very important you attend antenatal care, visit the facility often, so you and your baby can be healthy and you can have a safe delivery. On that note, we will end here and then come your way with another interesting topic. If you have not subscribed to my channel as of now, kindly do that. You are not doing well at all. Kindly support by subscribing and turning on your notification button to always be notified as and when we upload a video. Thank you very much.